Here we are demonstrating a left-sided balloon eustachian tuboplasty or a balloon eustachian tube dilatation for this patient. Now we see here how there is a gross amount of deviated nasal septum with a sharp spur that impinges on the inferior turbinate. The patient per se has no complaints of nasal obstruction, and the plan is only to dilate the left-sided eustachian tube because the patient is a patient of CA nasopharynx post-radiation therapy 2 years back, and now he has a persistent left-sided chronic serous otitis media. This patient has already had 2 prior laryngotomies and ventilation tube insertions, and the serous otitis media often recurs despite that. Now what we are doing is, since the floor of nose has no space to go for our rigid balloon dilation tool, we are using a blunt elevator to push the septum on the other side, because as of now we do not wish to do a formal septoplasty for this patient, but we do not have any space on the floor of nose to negotiate our eustachian tube catheter on this side. So our plan is to push this deviated part of septum and the spur to the other side to create some space for us to maneuver our instrument. Otherwise it is simply not possible to do from this side. And once we do that, we see that now immediately it gives us some space to take our balloon dilatation tool on the floor of nasal cavity. We can see how anterior to the torus folds, we approximate the eustachian tube orifice and take our balloon inside it. The direction has to be 30 to 45 degrees upwards. If the direction is not in sync or in line with the eustachian tube, the balloon will pop out. As you can see, it is partially popping out slightly, but not completely. So the balloon is inside for most part of it, but slightly coming out. So we will give another try to it to do it in a better way. One has to obviously keep a little pressure here so that this doesn't come out completely, as the balloon is deflated up to 120 seconds of the pressure that could vary based on the manufacturer of this balloon. In this case, this is a Merrill balloon dilatation system. Now we use it again. You can see the nasopharynx is right now clear. It has no evidence of any residual or recurrent malignancy. So now we have realigned the balloon inserting tool in the direction of the eustachian tube, and now we will be reinserting this balloon catheter, and now it has been reinserted and reinflated. This time it is a more snug fit and entry inside the eustachian tube orifice. You can see just the tip of the balloon protruding, and that is a good sign for us to visibly affirm that this balloon is right at the place and it is fairly inflated. And now once it has been 120 seconds of inflation, we will now initiate withdrawal of this balloon from the eustachian tube orifice. You can see how much of the length of the balloon was inside, and you can see how a dilated eustachian tube orifice looks like in front of the torus fold, and that completes our procedure.